And we're tracking the vaccine for you tonight. Local hospital systems across the Carolinas say they're dealing with vaccine supply issues this week. These problems causing large-scale appointment rescheduling in some cases. Now, medical officials say these shortages are leading them to discourage hospitals from offering those mass vaccination sites until more supply arrives. This week, we've seen people at multiple sites waiting outside for hours in those long lines, being told there just isn't any more vaccine left.
Matt Koufax checked in with health systems in both North and South Carolina. He's live tonight. And Matt, you know, we talk about these long lines, and these are folks 65 and up, some in wheelchairs, on crutches and canes. I mean, that's a long time to be standing in line.
Yeah, Cody, and not every day is as nice as the one we just had. One doctor in particular who I spoke to this afternoon tells me that it's worth looking closer at the relationship between mass vaccination sites and vaccine supply issues. It's led him and many others in the medical community to ask a question that's really at the heart of all of this. Are mass vaccination sites the best way to get shots into arms at this point in time? Dr. David Ellis with Party Health says they're frustrated by the vaccine situation.
It's hard for everybody. I mean, I'm not blaming the state. They're only getting so much vaccine. They have to decide how to allocate that vaccine.
After the Tar Heel state reduced allocations over supply uncertainties recently, Party's weekly allotment went from just under 1,000 to just over 400 doses. Ellis says they've had to reschedule upwards of 700 appointments.
At the time that the state had committed to Charlotte, to the big events that they had, was when we began to get a decreased amount of vaccines.
He's talking about two mass sites the State Department of Health set up at the Charlotte Motor Speedway and Panther Stadium in recent weeks. He believes local hospital systems can do it more efficiently.
And they run a clinic in Charlotte, and people from Hendersonville and Gastonia and every place else are driving to a big vaccination site. I think it's hard to make an argument that that's an equitable distribution of the vaccines. I think that vaccine is better distributed in local communities.
Citing supply concerns in South Carolina also, DHEC has established guidance that says no mass vaccination events should be held until further notice without consulting with the agency. This after incredibly long lines were seen in Greenville this week.
The communities are better equipped to do this.
Ellis says local hospital systems who know their patients better have the capacity, they just need the shots, and he's hopeful they get more soon.
We have no expectation. I mean, we just can't. You know, we got burned a little bit in having to reschedule all these visits.
Dr. Ellis tells me that they are encouraged, despite the recent issues, by the fact that the Johnson & Johnson vaccine coming up before the FDA soon. They say that as soon as it gets approved and gets into circulation, it'll definitely bring more supply. In the meantime, he wants to remind all of you at home that until we get a large portion of the population vaccinated, the virus is still very transmissible. There is not herd immunity. He wants you to keep wearing your mask, socially distance, and stay safe. In Greenville tonight, Matt Koufax, Fox Carolina, the 10 o'clock news.